Hello, and thank you for watching our video. This video is for educational purposes and will be providing a competency on performing a consistency of grip effort assessment using the JMAR dynamometer. The purpose of this video is to familiarize clinicians and students with the dynamometer and to provide instruction on testing for consistency of effort while adhering to proper procedure protocols, patient positioning, data recording, and data analysis. This is a JMAR dynamometer. Overall, a dynamometer is used to measure a person's grip strength. It is important to test for consistency of effort in order to produce quantitative results and to exemplify that the individual is consistently performing their maximum effort, thus yielding valid results related to their maximum grip strength across the various levels or handles. Parts of the dynamometer. The adjustable handle has 5 handle placements that can be utilized depending on the individual's hand size or to measure consistency of effort. The handle here is currently set to handle 1, followed by 2, 3, 4, and 5. The face of the dynamometer has a dual scale readout, which means the scale reads in both pounds up to 200 as well as kilograms up to 90. The dynamometer also has a peak hold needle. After the patient grips the dynamometer, the peak hold needle automatically retains the highest reading until it is manually reset. Changing the handles. In order to switch the handle placement on a dynamometer, one must first locate the handle clip, which is on the inferior part of the dynamometer. After releasing the clip, pull the inferior end of the handle away from the placement in which it previously remained. Then, pull the handle down and out of the superior placement. Next, replace the superior part of the handle in the following placement, followed by the inferior end in its inferior counterpart. Make sure to lock the handle clip. Improper handle placement can result in false readings. Patient positioning. The patient should be seated with shoulders level, adducted, and neutrally rotated. She should remain in an upright position with her feet flat on the floor. The patient's elbows should be flexed at 90 degrees with the forearm in neutral and wrist between 0 and 30 degrees of extension. The dynamometer should be suspended while maintaining proper formation and not to be resting on the patient's lap, an armrest, or any other surface. Before any testing should be completed, the practitioner should consider precautions and contraindications of testing grip consistency of effort. A quick screen of the hand being tested should be completed. Do not test before full healing from a fracture, ligament repair, or tendon laceration. Before full healing from a tendon transfer of the forearm, wrist, or hand. While an acute injury of the joint, ligament, or tendon, including sprain, of a digital joint or the wrist are still healing, if pain occurs at any point during the testing procedure, or if determined by the referring physician. Procedure. Instruct the patient on proper positioning using physical cues and guidance if necessary. Prepare the dynamometer by placing the handle in the first handle position, or level 1, and bring the peak hold needle back down to 0 before handing the device to the patient. Place the dynamometer in the patient's hand to be tested, ensuring the proper patient positioning, dynamometer placement, and that the peak hold needle is still set to 0. Instruct the patient to give maximum effort in a smooth manner and to not jerk the tool while gripping the handle. Record the pounds measured. Change the handle to the succeeding placement. Reset the peak hold needle back to 0. Place the dynamometer back into the patient's same hand to be tested. Repeat these steps until data is collected from each of the 5 handle levels. Consistency of effort in relation to grip strength is specifically important to test for occupational therapy practitioners because of the effect that decreased grip strength and inconsistent application of force can have on functional activities. Being able to measure a patient's individual ability to produce maximum force on a consistent basis can be applied to treatment and intervention planning related to strength, stamina, and fine motor activities. Graph the data on a line graph with the handle levels on the x-axis and pounds on the y-axis. If a bell-shaped curve is present on the line graph, the conclusion can be drawn that there is a consistent effort applied to the dynamometer throughout the testing. It is common that the highest numerical value derived from the dynamometer comes from the attempts on the second or third handles. In this case, the peak of the graph will likely depend on the size of the participant's hand. If the resultant figure does not have a bell-shaped curve, the conclusion can be drawn that the effort exerted on the dynamometer was not consistent.